Hello everyone, welcome back to upGrowth. If you run a clinic or a diagnostic center and you're spending on digital ads, do you actually know how many patients that budget is bringing in and what each one is costing you to acquire? This simulator tells you both and shows you how to bring that cost down over time. This is the patient acquisition cost simulator by upGrowth. It is built for healthcare businesses like clinics, diagnostic centers, hospitals, and specialty practices and is calibrated with healthcare specific benchmarks from real client engagements. So you have to enter details about your practice budget and primary marketing channel, and you get a full 12-month patient projection, growth projection, CAC reduction, and so on. So let's quickly check this out with a quick example. So seven inputs. Let us go through each one. First, set your currency into INR or USD, and monthly budget is your total marketing spend each month. I've entered 20,000 here, which is a realistic starting budget for an independent diagnostic center. Practice type is your healthcare category. You can select from the drop down. And current monthly footfall is the number of patients your center already sees each month. And revenue per visit is the average amount of patient pays per visit. And current CAC is how much you currently spend in marketing to acquire one new patient. I've entered 2000 there. And primary channel is where your ads run. I've selected Google Ads. You can select the relevant ones from the drop down. And city tier is your practice is located. Indian cities are grouped into tiers based on population and market size. Like tier 1 covers metros like Mumbai, Delhi, and Bengaluru. Tier 2 covers cities like Pune, Jaipur, and Kochi, and Tier 3 covers smaller towns and emerging markets. I've selected Tier 3. Now let's hit on calculate. So here is what the output shows. 12-month new patients is rupees 156. That is the number of new patients this budget will bring in over the full year. CAC reduction is 46%. The optimized CAC drops from 2000 to 1081, saving rupees 919 on every patient acquisition as campaigns improve over time. And 12-month revenue from new patients is 90 lakh 50,000. And the 12-month patient growth projection chart shows the total patient base growing steadily from 492 in a month 1 to 656 by month 12 as new patients accumulate on top of the existing footfall. The monthly breakdown table gives you the full picture. In month 1, 11 new patients come in, taking the total to 511 and generating rupees 1,37,500 in revenue. By month 6, that grows to 13 new patients, 571 cumulative, and rupees 1,62,500 in monthly revenue. By month 12, it is 15 new patients per month, 656 cumulative, and rupees 1,87,500 in monthly revenue. The patient acquisition funnel below shows how 156 people who became aware of the practice over the year moved through each stage. 125 reached consideration. They looked up the center, checked reviews or compared options, and 94 converted into actual visit, and 62 became retained patients, people likely to return for follow-up test or refer others. The key insight below confirms consistency across channels amplifies this effect. The CAC reduction happens progressively as the Google Ads account optimizes, which is why month 12 delivers more new patients than month 1 on the same budget. Most diagnostic centers and small healthcare practices in smaller Indian cities run ads without any projection of what that spend will return in patients or revenue over a year. They know their monthly footfall but not their cost per new patient, and they have no model for what consistent digital marketing compounds into by the end of the year. The simulator fills that gap. It shows that even a modest monthly budget can bring in meaningful new patient volume annually at an improving acquisition cost, with a clear funnel showing where each patient is in their journey from awareness to retention. So run this with your own footfall and revenue numbers before your next budget decision. The link is in the description. And if you want upgrowth to help you build a performance and SEO strategy for your healthcare practice, here we have a book free strategy call button. Click on it, get in touch with us. We can help you out. Thank you.